Good day and welcome to Lung Talk Living with COPD. My name is Tom Brockman and I'm a social worker. I'd like to spend some time today with you and your family, helping you to think what you might be able to do to improve your health, and particularly the health of your lungs. We're going to be looking today at the process of change. Change is something that we all go throughout the course of our life. If you're watching this video, you might be thinking about making some changes in your life with regards to your health, or you may be concerned about the health of a loved one. We're particularly interested today in trying to help you to think about changes with regards to smoking as it affects your health, particularly if you happen to be one of those persons that has chronic obstructive pulmonary disease, better known as COPD. We are going to be looking at a model today that helps us to understand how it is that we as people change. This is a model that was actually based on research that was done at the University of Rhode Island with people that were trying to stop smoking. If you notice, there is a circle which indicates that change is something that is constant and is inevitable throughout the course of our life. We want to start off looking at the reality that many of you that are viewing this video today have not even thought about changing your smoking or thought about how your smoking might have affected your lung health. Others of you may have been thinking about it for some time as you've made previous attempts to either quit or cut down, and may be wondering today about where you are and how you might like to proceed. Some of you might actually be at a point where you're actually prepared and are looking forward to being able to make some changes in your life with regards to your smoking and potentially improving your health. Others of you that are watching this video may have actually been able to be successful in having either cut down or stopped smoking for some period of time, and there are others of you that have actually been doing it for a period of at least 6 months. In the middle of setback, this is a real important area to consider, as many of you that have tried to stop smoking have had multiple attempts to either cut down or quit and may or not have been successful. What we'd like to offer is that any attempt to cut down or quit in and of itself should be seen as a success, and we'd like to offer you some more ideas and information so that you might actually be able to be more successful.
I was a smoker for 45 years, and even knowing how bad it was for me, I was very dependent upon it. I tried quitting many times, and each time I failed.
So it's important to consider that some of you that are viewing today may not have ever given any serious consideration to doing anything about your smoking. And for others of you, you may have heard this from your physician, your family, your friends, and other concerned others, but you yourself have not really made up your mind about what it is that you might like to do. So in order to start the conversation, we'd like to ask you to consider the following. If you look at this scale on a scale of 1 to 10, how important is it for you to make a change in your smoking, either to cut down or quit? A 10 indicates it's extremely important, a 5 would indicate it's somewhat important, and a 1, it's not that important. And it's also important to consider that since your behavior and your health impact other people, we also need to look at the same scale from the perspective of how important do you think it might be if we were to ask your family or friends, how important is it for them that you might initiate or make this change? And what we're looking at is trying to figure out how willing you might be to consider making a change in your behavior. In addition to considering how willing you are, we also have to consider, on the same scale of 1 to 10, how confident are you that if you wanted to make this change that you might be able to? So once again, 10 would indicate that you're highly confident, 5 somewhat confident, 1 not that confident. So now that we've looked at importance and confidence, we're able to look at what the difference is in terms of how willing you might be to change versus how able you might feel to change. And it's important to realize that there's often a difference because sometimes people feel it's important and what they lack is confidence. If that's the case, we would encourage you to consider all the other times in your life that you were able to make a change. And in particular, to think about all the times in your life that you might have been able to be successful either cutting down or stopping smoking for some period of time. For others of you, the difficulty might be that you have the confidence, but you're just really not sure that it's that important at this point, which is why we ask you to consider how important it might be to your family, friends, and loved ones. And the third scale we'd like to have you consider would be, on a scale of 1 to 10, how ready are you to make a change, where 10 represents being extremely ready, 5 is you're somewhat ready, 1, you're not that ready at all. So in going through and looking at these 3 scales, this helps you to hopefully be able to determine how ready, how willing, and how able are you at this point to do anything about either cutting down or stopping your smoking to improve your lung health. If we've been able to help you to go from not thinking to thinking about your smoking, now we would like to consider that some of you might actually be ready to explore options to a plan to either cut down or quit smoking. And we also realize that many of you that are watching this video may have had some prior experience and it may be familiar with strategies like the nicotine patch, nicotine gum, or a nicotine nasal spray. Some of you may also have used strategies like putting a number in your pack of cigarettes and every day reducing your number of cigarettes by 1.
And then, it wasn't just medications or patches. There are many different ways to help you to stop relying on the nicotine or the physicalness of the cigarette. I was not a failure. My failure was I had no plan. And that is the key to quitting. You need a plan.
In any case, the choice is yours, and we would encourage you to consult with your physician or healthcare provider before making any decisions about any of these options and choices. Ultimately, whatever choice you make is up to you. However, it's important to realize that there are abundance of choices today for anybody that's giving consideration to stopping or cutting down their smoking.
And for me, who truly felt that I must be so addicted to cigarettes that I could not quit, I did.
So if you've actually been able to figure out a plan that's going to work for you, then the next step would be actually looking at being able to do it. And for many of you, this may be a process that involves considerations like when do I want to do it, picking a particular date, consulting with your family and friends and seeking their support. Also thinking about what you're going to do at those times and places where you ordinarily would smoke. So for some of you, this might be situations like smoking in your car, smoking in your home, leaving your work or school to go outside and smoke, and how that's going to impact your relationships with those people that are still smoking. And if you're actually able to be successful, you'll then move forward into the next stage, which is you're actually going to be maintaining the changes that you've already initiated. So we'd like to thank you for being able to take a couple of minutes from your day to spend some time thinking with us about what some of your options and choices might be about either cutting down or quitting your smoking in order to improve the health of your lungs, your overall health, and the health of your family's lives. We thank you for watching this video, and we encourage you to contact your healthcare provider if you have any questions about any of the options that we considered.